Hi, I'm Brian Bird, Senior Program Officer with the New York State Health Foundation, and welcome to Practically Speaking, Building Vaccine Trust with Black Americans in New York State. Black New Yorkers have died nearly 3 times the rate of white residents. And while enthusiasm for getting the COVID vaccine continues to grow, Black adults still remain more likely than their white counterparts to say that they will wait and see before getting vaccinated. We have learned that major barriers to Black Americans receiving the COVID vaccine isn't so much hesitancy, but barriers to understanding the facts around the disease, the virus, and the vaccine itself. Last month, the Kaiser Family Foundation and the Black Coalition Against COVID launched the conversation between us about us. It's a campaign to provide Black communities with credible information about the COVID-19 vaccines. The conversation uses Black doctors, nurses, and researchers to dispel misinformation through videos that answer questions in an understandable manner. Hopefully, you've seen the video with W. Kamau Bell. I am very excited today to have 2 members of the Kaiser Family Foundation, Tina Hoff, Senior Vice President and Director of the Social Impact Media Program, and Robin Kistler, Media and HIV/AIDS Consultant with the Foundation's Health Communication and Media Partnerships. Together, they will discuss the campaign, how it was developed, lessons learned so far, and how they can be applied to vaccination efforts here in New York State. Just as a note, this webinar will be recorded. Slides and links to the videos will be available in the recap email. And also, video and audio is turned off for the audience. Please ask your questions using the chat box. And now I'm going to turn it over to our speakers, Tina and Robin.
Thank you, Brian. I'm going to share my screen. Thank you all, and thank you, Brian, for having us here today. I'm Tina Hoff, and as Brian mentioned, this is my colleague Robin Kistler, who's joining us here today. And Brian invited us to talk about the work that we are doing on vaccine information needs in communities of color. Just to give those of you who are not familiar with KFF a quick overview of who we are. We are a national nonprofit organization focused on health issues. We are not affiliated with Kaiser Permanente, despite the name similarities. We are known for our policy analysis, public opinion research, and journalism and communications programs, and our work in COVID spans all of these areas. We have spent the last 2 decades running large-scale public information campaigns on HIV and sexual health issues. One of our leading efforts is a program called Greater Than AIDS. Last year, we took the model of Greater Than AIDS and launched the Greater Than COVID initiative to help provide individuals with information to help them navigate the evolving pandemic. And this past March, we launched a campaign, which Brian mentioned, called The Conversation Between Us About Us, which was produced with Black healthcare workers for Black audiences to address information needs that we've identified in the community. Our physician lead in the initiative, Dr. Rhea Boyd, wrote in a recent op-ed in the New York Times that in addition to equitable access to the vaccines themselves, we also need credible information. And this is exactly what our campaign is setting out to address, to make sure that as vaccines become more available to individuals, that they have the information they need to make this important decision for themselves and their families. We really set out not to do a typical sort of just go get vaccinated campaign, but really to give people the information they need to move forward. And Brian mentioned some of the research that KFF has been doing. We have an ongoing polling project called the Kff Vaccine Monitor that's in the field every couple of weeks, looking at how attitudes and uptake are moving forward as we progress in this pandemic. And very encouragingly, in our most recent data, which just came out a couple of weeks ago, we've seen significant movement forward in the population that has been waiting and seeing to make a decision about getting the vaccine toward intent to get vaccinated. And a lot of that is on the strength of information that's being provided to them. The project that we launched, The Conversation, is anchored by a video featuring W. Kamau Bell in conversation with Black doctors, nurses, researchers, and scientists. The 5-minute video, which I hope you get a chance to take a look at, covers some of the top issues we hear. It's really meant to be an engaging, sort of honest conversation that mirrors the types of conversations that people may be having with their friends and their families. The video has over 1.2 million views just on YouTube as of today, probably even inching upwards as we go. It's been very well received. It's also helping to drive views to a video library that we created with the healthcare workers answering common questions. So these are more than 50 short FAQ videos with our healthcare workers tackling the topics in easy to understand, accessible ways, but also fully transparent, honest information. This is the website that you're seeing. You can see the links there. If you want to take a look at it for yourself, you can navigate all of these FAQs. They're searchable by provider as well as topic area. On the site, we also link to vaccine locator information, the vaccine finder, zip code locator provided by the CDC, to state pages so individuals can look up eligibility and information. We also have a toolkit to provide to community groups to help them support and get out this information. And Robin's going to go into a little bit more detail about what we offer there and how folks are using this campaign. We also have more information from the providers themselves. Part of this is really helping to make the connection that the healthcare workers themselves are navigating this pandemic. I'm going to share a video in a little bit that'll show more of why they are part of this, which I think helps people understand more about what this issue is and how it's affecting our lives and what the vaccines can offer. We also link to other resources. Our partner in producing the campaign is the Black Coalition Against COVID, which brings together many of the leading Black-led organizations, health and community organizations. So we were thrilled to be able to work with them to get this out. We've had other partners like COVID Black work with us and be very enthusiastic in helping to support the content. On the screen now, you can see a little bit of a sampling of some of the response that we've gotten to the launch of the campaign and the types of groups that are really embracing this messaging. We've been thrilled to see many prominent Black leaders, community leaders, healthcare organizations, and others utilizing the content and talking about its value to them. One group there that popped up is Fair Count, which is a group you may be familiar with, which is Stacey Abrams' group that has worked on census issues in the South. We're now working with them to integrate the content into community outreach, and I think Robin's going to share some of that work as well. We've also had a great response from health departments. In our HIV work, we do a lot of partnerships with health departments to get out this information. And we've been very excited to see health departments responding to this content. Several health departments, including here in New York City, also in California, have been using the content and integrating it into their own campaigns. And there's a lot of ways we can do this that we really support and encourage. One last tweet I wanted to share that really stood out for us, and I'm excited to say we've been getting more and more of these, is from an ER doc in New Jersey who messaged us right after the campaign launched. And as you can see here, he took the messaging, showed it to a patient he was talking to about the vaccines, and was able to move from consideration to decision about the vaccine. And as Kamau responded, this is exactly what you hope for when you're doing these kinds of campaigns, but often don't get this kind of immediate feedback. And again, we're hearing more of this kind of work, and I think it's a really exciting way to use the videos and the content. And before I turn it over to Robin to talk more about how the campaign can be used and is being used by community organizations, we did want to show you one video. This is a video that features conversations with the healthcare workers about why they are a part of this messaging. And if you give me a moment, I'm going to share my video screen here and show you this clip.
What I don't want to happen 2 and 3 years from now is for Black people to have been left behind. And for people to be able to use some excuse where, oh, Black people said they didn't want the vaccine anyway, so that's why we didn't distribute it to their communities. That's what I'm trying to avoid.
We talk a lot about trusting the vaccine, trusting healthcare systems, but we as healthcare systems need to trust patients. We need to know that they really want what's best for their families, and it's a two-way street. So that bi-directional trust, that's what we're working to build.
Things are moving very quickly and they're very complex. And so I think everyone is having questions, everyone is having concerns, as we can see. But I think this piece around the history of African Americans as it relates to everything in this country, but specifically as it relates to healthcare in this country, is all very real.
I think people have to recognize that we have this horrible history in medicine. And part of me being here today, part of me sort of talking about the vaccine is hopefully to share the data that we have that really does promise great efficacy for the vaccine. It was tested in a diverse population.
I just kind of put the information out there. I share data and studies that I think are influential, that are important, and that are based in scientific rigor.
I am trying to make sense of this, just like our patients are, just like, so many people are in our community, and figure out, amidst all the noise and everything that's happening and all the misinformation that's out there, what do I need to do to protect myself and my family and my community?
As an African American woman, I'm aware that African American women have a higher perinatal mortality rate, right? That African Americans have a higher COVID rate and COVID death rate.
This is a pandemic that has disproportionately affected more people of color, people like me. And if anything at all, that should, turn on the light bulb to say, let me make sure I actually don't get this.
I think it's so important to get the information out to the community. We have a vaccine now that can help curb this pandemic, stop the loss of, needless deaths that we have in our country.
I am a Jamaican, self-professed, born in Jamaica, raised in New York, and now live in Atlanta. And I am family-oriented, faith-driven. And not being able to see my family was extraordinarily impactful for me personally.
I see, in terms of a lot of my patients and even also my friends, this pandemic has taken a toll on their mental health. In terms of depression, in terms of substance use, et cetera. And so my hope is that once we have gotten people vaccinated, we will get back to a place where we feel normal again, where we can live again.
So it's really personal and really important for me that Black and brown people get vaccinated. We cannot wait. We need to get this done. This is a chance where we can level the playing field and make sure that we have equitable access to something that is really life-saving.
So what's going to happen when we get enough people vaccinated is that we're going to see the death rates go down. Then we're going to see the hospitalization rates go down, and eventually we'll see the case level go down.
So that gives you a little bit of a taste of the people that are in the campaign. I think it's really important, we've seen, for people to understand what the motivation is for being a part of this. Both these are individuals with medical and healthcare expertise, but they're also people navigating this pandemic in their own lives. It really helps sort of build, I think, an understanding and a trust in what they're sharing. And we've been really thrilled to have them in the campaign and being a part of this. We are now in production on a Latinx installment of the campaign that will be coming out in the beginning of May to add even more voices to the initiative. So stay tuned for that. And now I'm going to turn it over to Robin, who's going to talk more about how the campaign can be used and is being used by partners.
Thank you so much, Tina. I remembered to unmute, so I've already met my obligation here on the Zoom. It's really nice to meet you all. I wish we could see one another, and appreciate that you're taking this half hour to join and learn about the conversation and talk about ways to share it. I've already seen in the chat several groups, the CUNY campuses are talking about using the video series, and we're happy to follow up with Alona on that effort. Elizabeth talked about using it in FQHCs. Those are exactly the types of things that we want to happen as building out the conversation in addition to the digital spaces, getting out to community groups with you. So we wanted to talk through some specific ways to do that. In the meantime, if you have reaction to that video, there was a lot in there and we just wanted to digest it a little bit together. Feel free to drop in the moments that maybe resonated most for you or that really stood out for you in terms of your own experience of the pandemic or what you think would be most valuable for your own constituents to hear. We can make this as interactive as we can given the format that we have. I was particularly excited last week because New York City had shared the series out with all of their CBOs and contracted outreach partners, and the Brooklyn Public Library put out the series in a tweet to their 40,000 followers. And as a Brooklyn resident, it was really nice to see that that trusted institution is lending their voice. So we want to see that replication happening all across the country, and especially here in New York. Tina, I think we could go to the next slide. For the next few minutes, the main thing I want you to take away from this is that everything is free. And if you have an idea for how to use it, the answer is yes, please use it. We want to get it out in every possible way. Tina's showing the YouTube channel here. We've grouped everything into playlists so you can easily find, there's more than 50 videos. We're adding more this week, the Latinx series in a couple more weeks. So it's a lot of content. If there's something, you don't have time to watch all 50 minutes of videos, if there's something you're looking for, feel free to message us and we'll help point you in the right direction. But we have tried to make them very navigable and easy to find the topics that are of interest to you and the areas that you're working. Couple of ideas. Ebenezer Baptist Church used the videos and streamed them into their church services 2 weeks ago. So they're meeting by Facebook Live anyway. Drop in the 5-minute anchor video with W. Kamau Bell that was circulated before this webinar. If you haven't watched it, it's a great starting place. It brings all of the issues into one place. And of course, people have more in-depth questions, so the FAQs are good follow-up. So that idea of virtual spaces where we're already gathering, where large groups of people or small groups of people are connecting to insert the video as an educational piece, as a conversation starter. There are unlimited ways that we can use it. In Sacramento, a local well-known barber came together with several gospel artists and had a town hall meeting with their own local provider, showed the videos and used it to build out a conversation. So thinking about ways you can share it out digitally, which we'll talk about, but also to create events and gathering spaces to literally have your own conversations based on the series. So this is the digital toolkit. You can see the URL. You can get to it also through the main landing page that's in the link in the chat, and we'll be going out afterwards. Just look for the digital toolkit. It starts with an introduction to the project. That's a quick copy paste into your newsletter, whatever e-communications you're sending out, share it with your staff, your constituents, your clergy, your grantees. You know, there's a lot of groups on this call, so whatever role you're playing in the pandemic, there's an opportunity to share it out with those that you are connected to. I started with my own family. There's still one person that I'm working on, but we're getting there. So in any ways that you can think about to share it out, we're trying to make it really easy to kind of copy and paste. The state of Virginia has embedded the whole series as a community toolkit in their COVID communications hub. So all the local health districts, all of the local contracted CBOs have access to it as part of the statewide campaign. Los Angeles, test and trace community health workers are walking around with iPads anyway, loading the videos onto those iPads. So just really thinking about where are people making those connections? Where is the information needed? And how can we embed this information there? Tina, if we could jump to the next slide, please. I think there are instructions about how to embed the videos on the toolkit. It's very easy, free, especially for folks who know how to program a website. They'll know how to copy the code. We've got a little cheat sheet here, but you can bring in either, the anchor video, the main one with W. Kamau Bell. You could do the entire library, pull it in and zhuzh up your website for next to nothing, adding so much information and also a little pizzazz onto the website, or pick a particular playlist or a couple of playlists that you think are the most resonant and important to include there. Next slide. So these are some graphics. We're trying to provide formats for whatever you're doing, so you've got the pieces that you need. These can go into websites, they can go into newsletters, they can go into social media. And also on the toolkit, we have easy copy and paste social media text. So we know nobody has any time right now. We're all multitasking and serving double duty. So making it really quick and easy for you to be able to grab those, paste them in, and continue on. The videos themselves lend themselves to social media too. The question that they ask, those FAQs, you just copy the question, put it with the video into a social media post, and you're off and running. So, and there will be hundreds. There's more than 50. That's 2 months of social media posts. We've got you covered. Pick your favorites. Okay, what's next? We have broadcast, I believe, the TV and radio PSAs. Tina, if you wouldn't mind clicking to the next. We watched Embedded. We did our graphics, print materials. These are flyers, 8.5 by 11, print on a regular printer and put them wherever you have people passing by. We are not encouraging folks coming in close contact, but taping them up on the bathroom stalls, putting them in vaccination sites at the clinic so that folks can scan the QR code and have access to those videos themselves. Those who are already getting vaccinated are great messengers to their friends and family to spread around. Church bulletins, anywhere else that folks can be passing out or displaying information. I think business initiatives we've heard. In fact, we designed these because a hotel in Ohio wrote to us and said, I love this series. What can I put by my coffee station in my hotel in rural Ohio so that my guests have access to the information? We'll also be expanding on the print materials to add some door hangers, some palm cards, and other community materials toolkits that can be out physically on the ground. So let us know if there's specific information needs that you have. And be sure to sign up on our newsletter so that when those are available, we can make sure that you're getting the offering and you can make a request and order. I think at some point, I think there was TV and radio PSAs we passed over. We do have 30-second spots for anyone who is buying media and would like to promote the campaign. I can work with you on logistics for that, but they are on the toolkit and are downloadable, along with a back-to-back version of all 50 videos. So in clinical settings, and in fact, 2 different jails, one in Alameda County and another in Seattle, Washington, are using those in their waiting areas in the community guest centers, so that both staff, folks who are incarcerated, and as well as their community family members can come in and take a peek. So we want to make sure there's a few minutes for time. I will wrap up, but I just want to make sure that everyone has access. Either put your email into the chat, or if you go onto the website, look for the join the conversation box with email us, drop in your contact information, and we look forward to staying in touch.
Great. Well, thank you, Tina and Robin. I've been monitoring the chat, and it's interestingly, as the questions were being asked, either Tina or yourself, depending on who was speaking, we're answering them. But there is one question that I thought maybe you guys can answer, and it says, how is the Kff campaign getting the message out to people of color who don't have access to the internet, Wi-Fi, smartphones? Are there pop-ups in the communities or written materials? Now, I know that you did mention that, but I just thought maybe if there was anything else that you might want to add to what you've already said.
Yeah, that's a great question. And I'll start and then invite Robin to jump in, who's really been working on these projects. So we designed the campaign as a digital, social, shareable campaign. However, we also recognize and have a strong interest in getting it out more widely into folks who aren't necessarily on YouTube or maybe don't have as accessible of internet. So we've partnered with organizations on the ground that are doing this work. Fair Count is a great example of that. We're working on a partnership with them in 7 southern states to take the messaging out into the community. So that's utilizing some of the promotional messaging that Robin mentioned that we're working on developing. I think it's also a great idea that we've seen a lot of groups do is download the videos onto their phones or tablets and use them to share and use in discussions while they're out on the street in their pop-ups or doing kind of the more one-on-one communication. We also are able to provide the content in forms so that it can be available without internet access. So for example, the looping video that Robin mentioned that the jails are using and some other groups, so where there are opportunities to interact in person. Robin, I don't know if you want to add any other examples, maybe the telehealth events.
Yeah, so part of what we're doing with Fair Count, and there are others that are using census worker, the census wrapped up right as COVID was really hitting its peak. And so I think that there's been a natural connection between those who literally know door to door folks who are getting left out of digital components. So using those print materials to provide the basics of the messaging, starting with it's free, right? Like this is a fundamental piece that we need to make sure folks know, that cost isn't a limitation, and that they have access to get information from credible healthcare providers, even if they don't personally have a healthcare provider. We want to make sure that they have access to that information. So printed materials going out door to door, and then by phone. So adapting versions of this, playing some of the audio, which works really well on phone teletown halls, that have worked well for voter organization, a get to know the candidate kind of idea, where you can call in and have a phone conversation with a medical provider, and using some of these resources as messaging points. So there are lots of strategies, and I know folks on this call have creative ideas too. We look forward to hearing.
Right. All right, we have time for one more question, and this one I think will be interesting to see how you answer it. One person wrote in, do any of the videos address line jumping in communities of color by affluent/white people, and how this contributes to hesitancy and mistrust? So I think it's kind of a little bit of an access issue.
Yeah, I mean, and certainly, access to the vaccines, both equitable distribution of vaccines and then ease of access to these vaccines are real issues that we are seeing emerge. And our campaign is focused really on meeting people with the information needs. At the same time, we are working with groups that are helping to bridge those access issues, and want to make sure that those go hand in hand. Dr. Boyd, our physician lead, as I mentioned, has been a particularly strong advocate and voice in bringing attention to the challenges around access, and how that is, as you said, sort of arguably the biggest factor when we see these vaccine uptake lags that are being documented. So I would say, part of what I think we're looking at doing, particularly with the Latinx messaging, as we've talked about, is making sure that we are highlighting programs that are helping to bridge those issues and are geared toward reaching the communities that we're speaking to, and bringing down some of the barriers to access by making it easier to register, or limiting access to individuals in select zip codes. But, it's certainly, those are huge and significant issues that I think we're all unfortunately witnessing happening in many communities.
Right. Last question, and then we have to go. Different languages. I'm assuming that there are plans to have this translated, this in other languages, such as French and French Creole, et cetera, et cetera.
Yeah, we in an ideal world, we would have this content produced with a variety of speakers in other languages, given the capacity and time urgency of getting it out. We did the first one in English. We can provide subtitled versions in alternate languages if there were a significant, sort of opportunity and need to use that. We recognize that has limitations in terms of literacy issues. We will have a Spanish language content that will be available soon, May. So that will expand offerings, at least somewhat. And I know there are some groups that are, sort of looking at kind of, again, how to do sort of translated. We appreciate it's not everything that we would hope, but we have to offer.
All right. Well, it is now 1:30. I'd like to thank our guests for joining us, Tina and Robin. I hope that the audience has learned as much as I have being involved with this campaign. Join us on April 19th for a webinar on how public housing residents in New York City can better advocate for safe housing conditions. If you do have other questions, please feel free to either email me and we will forward it to Tina, or as you can see on the screen, there's their emails. You can email them directly. Thank you again for joining us, and have a great afternoon.